ICD-10 skin cancer coding. So before starting this session, I would like to ask you one question. What is the difference between skin cancer and breast cancer? This is the very confusing question for the new coders. If you want to know the answer, please watch this video until the end. In this session, we will learn what are the types of skin cancer and what is the hierarchy of skin cancers. And also, we will know how to identify cancers based on anatomical areas like breast, prostate, kidney, and other organs or anatomical areas. So basically, we have three types of cancers in the skin. Okay, so we have BCC, basal cell carcinoma, that is the first type of skin cancer. Next one is squamous cell carcinoma, second type skin cancer, and next one is melanoma. Okay, so these are the common variants of skin cancer we will observe during our ICD-10 live coding. It is very important to note that all these three variants are having different sets of codes. So whenever you want to code, don't consider BCC, SCC, melanoma are having same ICD-10 code. We have separate sets of codes for all these three types, which we will learn soon. And also, if anyone looking for medical coding jobs in USA, India and UAE, please join in our WhatsApp group. Group link is the description of this video. And also, if anyone looking for surgery training, IPDRG training, SCC training, CCA certification training, please send WhatsApp message to 707-526-3939. So first we will learn what is the difference between skin cancer and the cancer which is related to anatomical organs or anatomical structures like breast and prostate. So as the name indicates, skin cancer will arrive on only skin on the anatomical organs, not on the deep tissues. For example, if you see cancer, so that time you need to check what type of cancer physician is telling, whether it is squamous cell carcinoma of the breast or breast cancer. Okay. So if you want to identify whether breast cancer is related to deeper tissues or not, you need to check the pathology or your operative report. Okay. If it is skin level cancer on the breast, so physician will perform superficial excision of the breast cancer. So using the tissue you need to identify. If the cancer is in the epidermis and dermis level, you need to code it as skin cancer. If the cancer is in the deeper levels, you need to code them anatomical area cancer like breast cancer, prostate cancer, all those things. So important thing, based on the depth of the cancer involved, skin level like epidermis, dermis, skin cancer, deeper tissue level, that time we need to code based on anatomical areas. First we will see basal cell carcinoma. Okay, so basal cell carcinoma usually we will call it as BCC, which is the most common skin cancer. Okay, so what are the characteristics of basal cell carcinoma? It is slow growing. Okay, so less aggressive and rarely spreads. Okay, so slow growing, it will not grow fast. So less aggressive. It will grow but slowly, very slowly it will grow. Okay, next, rarely spreads. So mostly BCC will not spread to other organs or other nearby organs. So rarely spreads. Most common area for basal cell carcinoma are face, nose, ears and sun exposed skin. Okay, so if you see this cancer in these areas, mostly you need to consider them as basal cell carcinoma, but you can't assume like that, but you need to check the path report for specificity of cancer. And in ICD-10 we will use C44 series for basal cell carcinoma or BCC. In the documentation sometimes they will not tell basal cell carcinoma, directly they will tell BCC. So that time you need to code based on the path report. Next we have squamous cell carcinoma. So usually we will call it as SCC. So BCC is basal cell carcinoma, SCC is squamous cell carcinoma. So squamous cell carcinoma is more aggressive than BCC. So which is severe guess among SCC and BCC? Please write in the comment section of this video. Okay. So squamous cell carcinoma is having capability to invade deeper tissues if you don't take any treatment. So what are the common areas for squamous cell carcinoma? Scalp, hands, face, arms. Okay. So most of the time, whenever you want to code these carcinoma, check the location. Where is this carcinoma? Mostly it will appear on scalp, hands, face and arms. So what is the ICD-10 same coding tip here? So whenever you want to code squamous cell carcinoma, you need to use C44 series along with site and type. What type of cancer it is. So these are the characteristics of squamous cell carcinoma, which is more aggressive than basal cell carcinoma. Next we have melanoma. So the most serious form of skin cancer. So if you take it as hierarchy among BCC, SCC and melanoma, melanoma is a true skin cancer or more serious skin cancer. Okay. So melanoma develops from melanocytes and has a much higher risk of metastasis. So melanoma is having the very aggressive nature and it will spread to other organs easily. And it will grow very rapidly as it is having higher risk of metastasis. When do you see the documentation for melanoma? From ICD-10 CM side, you need to use C43 series. Okay. So for BCC and SCC, we need to use C44 series. For melanoma, we need to use C43 series. So whenever you want to code skin cancer, you need to check the documentation and you need to follow these guidelines and which code we need to use. So okay coders, thanks for visiting our channel. So if you have any doubt, please mention in the comment section. If you like this video, please click on like button to motivate others to watch this video as well as inspire YouTube to change this video to other coders. As usual, if anyone looking for these trainings, please send WhatsApp message to 707-526-3939.